When is the right time to start tube feeding a patient with dementia? Never. When a person with dementia stops being able to eat, families worry that they're going to starve to death. The inability to recognize food or even to be able to swallow happens a lot with dementia patients. In fact, with most, unless they die suddenly from another cause. It's important to understand that this is a normal part of the disease process and the dying process, and it's not painful. There comes a point when it's no longer safe to feed someone with dementia because they may aspirate, inhale the food into their lungs and develop pneumonia. It can be hard to watch someone not eating and to not feel like you need to do something about that, especially someone you care about. A usual approach is to get a SLT referral, speech language therapist. Their job is to evaluate the person's swallow and make recommendations for other ways to get food into them. That might be a mechanical soft or a pureed diet and or thickened liquids. But sometimes that evaluation results in a surgical consult for a feeding tube, and that is where we should really think about drawing the line. Putting a feeding tube into a person with end-stage dementia might prolong life, but it will also potentially prolong suffering. It's a surgical procedure to place the tube, which comes with all kinds of risks, and you're putting food into a body that is shutting down. Eventually, those tube feeds can no longer be processed. They can back up into the airway and the person can develop an aspiration pneumonia, which is one of the things you were trying to avoid by placing the tube in the first place. As far as starving to death, it's rarely starvation that ultimately ends the life of the person with dementia. It's usually a combination of things. Falls with major injury, malnutrition, underlying diseases such as diabetes, infections like pneumonia, and cell death. If you're faced with a recommendation to place a feeding tube in your person with dementia, consider it carefully. It's usually harder to make a decision to remove a life-prolonging intervention after it has been started than to decline starting it in the first place.